Hi, this is Dr. Michael Brisman, neurosurgeon from Long Island. I just wanted to share some interesting cases and techniques with you. So, one of the diseases I treat a lot of is trigeminal neuralgia. This is a specific type of facial pain condition where patients get intermittent, sudden, brief, severe jolts of pain in the face that are described as usually electric shock or stabbing, severe pains in the face that are often triggered by light touch and often improve with seizure medicines, particularly carbamazepine and oxcarbazepine. So usually we first try to manage these patients with the medicines, and often that's fine. And sometimes patients will have spontaneous remissions as well. In the event that medicines are not adequate or there are side effects from medicines, there are different procedures that we can offer. One procedure involves moving a blood vessel away from the nerve, which can be done through an approach called a microvascular decompression. A lot of patients, that's not the best approach because either they're older or they have some medical issues or they have multiple sclerosis and there is no blood vessel. So in those cases, we may want to injure the nerve a bit. And one way is with some very focused radiation, something called gamma knife, but another way is with a percutaneous technique, which I'm illustrating here with this image here. And the percutaneous techniques are ways of injuring the nerve in a pretty minimally invasive way. These procedures take about 20 minutes. I do them in the operating room with local and IV sedation. Patient sedated, we put the needle in about an inch from the corner of the mouth on the appropriate side. And I always have one finger inside the mouth when I'm putting the needle in to make sure the needle goes through just the soft tissue of the cheek. We don't want the needle to go through the inside of the mouth, which is not sterile, because we're going to go into the head. And this just shows how the needle, once we get to the foramen ovale, the oval hole at the bottom of the skull through which the third division of the trigeminal nerve exits, once we get through that hole, we're able to get intracranial. And when the needle is intracranial, we can get to the retrogastrian space, to the space behind the gastrian ganglion, where the nerve branches into three divisions right here. And once we're in that location, there are three different ways we can injure the nerve to give relief of pain. One is by heating the needle a bit, that's called radiofrequency. The second way is by injecting some alcohol, something called glycerol, that can also injure the nerve a bit. And a third way is we can inflate a little balloon against the nerve once we're there and squeeze the nerve a bit. Either way, the procedure is pretty low risk. The downsides are the procedure can wear off over time and may have to be repeated because the nerve can regrow. There's also some possibility of some numb feelings afterwards. You can feel like you've been to the dentist because we're injuring the nerve on purpose. Usually that's not too bad, and often that gets better with time. And people do prefer having some degree of numbness to the severe pain. But this can be a very effective treatment for people who are suffering from the severe pain of trigeminal neuralgia that just isn't being controlled with medicines. So thank you for hearing about this interesting and helpful approach.